Now 6:05, so I'm going to go ahead and call our July meeting of the Area Hospital District Board to order. And we're going to have our public meeting, our public comment section, and we have 7 people signed up. The first, I'm going to abbreviate this, but you have to hold it real close. All right, there we go. Okay. Please wait to speak until you are called upon.
466-474, code Ray MCU.
When we call upon in person in number or order on public comment form, you fill out. Speakers may not convey donate their time to another speaker. Please limit your speaking time to 3 minutes. You'll get a warning at 1 minute remaining. The main purpose of the public input session of the hospital board meeting is to allow attendees to direct comments to the board of directors. No questions will be answered in the public input section. Please keep in mind that the purpose of public comment it's not a forum for public debate. No inappropriate comments or behavior. Let's be civil. And let's go start with Sherry Rowe.
Okay. Good evening. I did not prepare anything, so I am
Sherry, can
speaking.
you get right on the mic?
I'm speaking directly from my heart. I had some ideas of things that I was thinking about, and then the 4th of July happened. My name is Sherry. I'm a nurse here and have been, as of tomorrow, 7 years at Bay Area Hospital. I work up on the medical care unit, and I'm one of the charge nurses. I've been a nurse for a very long time and much larger institutions in Bay Area Hospital. But the events of the 4th of July, and everybody knows what happened that day. I'm a medical nurse, but I had the opportunity to go down and help our emergency room. And I'm still processing all of that. I'm standing in the middle of the hall looking around, and the love and compassion and strength and commitment that I saw that day, that I witness on my unit every day, but I don't get out of my unit very often. And it was, it sparked something inside of me that we have to survive. This hospital has to survive. I've never worked in an institution where I walk down the hall and I know every single person that I come in contact with that works here. And I like that. My goal is to retire from Bay Area Hospital. And in 9 years, I'd like it to still be here. That's my target date to retire, hopefully. But it was just the experience of seeing the healthcare professionals pull together as a team and save those lives and help those people get through what was probably one of the most traumatic experiences of their life, which is now added to my PTSD, as any other healthcare provider can attest to. But it just fueled me of how important it is that we survive this merger or whatever the plan the board is going to put forth. And I have nothing but faith that you all have the same goal that we do, as well as all of these people behind me. This is our home. This is where we live. We raise our families. We own our property. Our kids are in school. And it's just, I just would like to see positive there. And sorry, again, I didn't prepare. I think that the newer board members may need to know the pulse of what the employees are feeling. And we're terrified. We're committed here. I never left to go travel nurse during COVID. I never left here once to go find better opportunities. This is my opportunity. This is my home. And I just think that if the board and individuals understood how terrified we are as staff members of what does the future hold for Bay Area Hospital. I know you can't give us answers right now. You're working on that. But we need to know. We need to know, are we going to be able to move forward? Are we going to have jobs? Are we going to have infrastructure? Is Coos Bay going to survive? Because this town will not survive without Bay Area Hospital. That's it. Thank you.
Thank you, Sherry. Thanks, Doug.
Thanks, Sherry.
A letter to the members of the Bay Area Hospital Board. Welcome to the Bay Area Hospital family. As one of the many leaders who care deeply about this institution, I want to take a moment to share my personal journey and, more importantly, the unwavering support that exists within our leadership team for the current administration. My name is Chandler Marcotte, and I stepped into a leader position at the beginning of this year, but my journey started much earlier. I've worked at Bay Area Hospital on and off since 2010. I've worn many hats, from medical records to CNA, from endoscopy tech to registered nurse, and now I serve as a clinical nurse manager. I've witnessed the evolution of the hospital through multiple administrations, and I can say without hesitation, this is the best team I have ever worked under. There was a time when I, like many others, chose to leave Bay Area Hospital because of the atmosphere under previous leadership. It was difficult. There was a sense of disconnection and frustration, and yet what has emerged in recent years is something profoundly different. An environment built on collaboration, compassion, and mutual respect. A year ago, I sat on the union side of the negotiation table. I expected tension, and I'd heard stories about how leadership in the past had treated frontline staff with hostility during contract talks. But instead, I experienced something rare. Genuine dialogue, questions were met with thoughtful answers, rationales were explained, not imposed, and it wasn't a battle, it was a partnership. Even coming from the OR, a part of the hospital that often feels isolated, I was recognized by name by both our CEO, Brian Moore, and our CNO, Jen Collins. That kind of connection is not common. I'll never forget a particular day during a massive trauma. I stepped out to grab supplies, and there they were, Brian and Jen at the OR desk, asking how they could help. My director, Devin Turney, and my manager, Josh Reeves, were in scrubs and working side by side with us. This isn't symbolic leadership. It is real, present, and hands-on, and it extends beyond the administration. Our chaplain, Lindsay Moore, is in nearly every leadership meeting that I'm in. She directs our No One Dies Alone program, a service that ensures compassion in the final moments in life. And she manages a student volunteer initiative that changes the lives of our local teens. And she is often the first to respond when somebody in our hospital family is in need. She is a light for our staff, our patients, and our community. As new board members, the decisions you make will have real, tangible impacts, not just at the executive level, but all the way through those of us who are working the floor. There's a ripple effect that begins at the top. When administration is supported and empowered, leaders are able to lead with clarity and confidence. That stability then flows to the bedside, where nurses and frontline staff feel supported, valued, and focused on what matters, patient care. Conversely, instability at the top can quickly create uncertainty at every level. We have seen both sides of this, and we know how much it matters. I understand that recent elections were driven in part by criticism of this administration. I would ask you, before any decisions are made, to take time to truly know the people behind these roles, because I've seen who they are. They are the first to respond, the first to ask how they can help, and the last to take credit. You are stepping into an incredible responsibility as board members, and we welcome you. We also ask that you honor the reality many of us live every day. One of gratitude for the leadership that has transformed this hospital into a place where we're proud to work, serve, and lead. Thank you for your time. And as it turns out, leadership matters.
Next up is Devin Turney.
There's another one.
I too have written you a love letter because of fear of public speaking. So let's go with it. Not give the same love to the two of you. Thank you for all of your service, but this is to our new board members. Congratulations to our new members and welcome to the board of directors for Bay Area Hospital. Your willingness to step in to a leadership role, especially in such a critical and challenging time, is commendable. Bay Area Hospital's mission is clear and powerful. We improve the health of our community every day. That mission isn't political. It is a standard we strive to meet in every decision we make, from the bedside to the boardroom. I've been an RN for coming up on 26 years. Most of that time as a frontline nurse. Unlike many of our leaders, I have worked for several large organizations outside of Oregon. Over the past few years, I've had the privilege to be a member of the Bay Area Hospital team, serving within the surgical services and navigating some of the most difficult decisions of my entire career. I've done so alongside our CEO, Brian Moore, and the rest of the leadership team. Every hard conversation, whether about restructuring, reducing expenses, or protecting access to care, has started with the same way, with Brian Moore asking me and others, How will this affect our community? Every decision that I have made with Ryan Moore starts with, how will this affect our community? That question has grounded every decision in the hospital's mission, and I believe it's the reason we've made progress even in the face of overwhelming financial and operational headwinds. I understand that some of you were elected with a mandate to remove Ryan Moore and prevent some outside financial partnerships. Those positions may have been driven by individuals and interests who backed your campaigns. But now that you're seated, you answer to a broader constituency. Patients who depend on us, staff who have kept this hospital running, and the entire region relies on Bay Area Hospital as the only full-service healthcare option the Southern Oregon coast has. Like Brian, you now carry the responsibility, not just to be responsive, but to be wise. Caring for our community is a team sport, and tonight you joined the team. That team includes our providers, nurses, technologists, support staff, and most importantly, our patients. And this team has continued showing up every day through financial strain, pandemic fatigue, and staffing shortages, keeping our mission alive. I want to share my own opinion for your consideration. Disruption of our leadership team during a time of scarce resources is dangerous. It risks unraveling fragile systems and threatening outcomes that are already so very sensitive. I implore you to take time to understand what is working, what is not, and the real risks before acting. If your goal is to protect this community, there is another path. Your responsibility, the mission, and the very real progress we've made. Rather than defaulting to the loudest demands, consider the quiet majority of patients, families, and frontline staff who just want stability, access to quality care, and a hospital they can count on to be there when they need it. You've joined the team. We welcome you, and we need you to lead thoughtfully, because the stakes are extraordinarily high and any negative outcomes could be devastating to many. As you move forward, please ask yourself this question: how will my decisions affect our community? Thank you.
Thanks, Debbie.
I'm Shelley Maloney. I'm the medical care unit manager. I've been with the organization for almost 12 years. I've been in management through COVID. It's been almost 5 years. And thank you for listening to my concerns. First, I would like to extend a warm welcome to our new board members. You've joined us in a pivotal time. We're navigating a period of financial recovery, one that represents both real challenges and meaningful opportunities. We all want what is best for the hospital: financial stability, high quality patient care, and healthy work culture. That is the foundation of my comments today. Culture doesn't live in mission statements. It's shaped daily by leadership. There's employees that live the mission to improve the health of our community every day. Our executive team has and does play a critical role in steering us through this financial difficulty. They have a deep institutional knowledge, established relationships with staff, and are actively engaged with our management team to work on projects intended to help with this financial turnaround. Based off campaign platforms, it has been suggested that Brian Moore may be on your agenda to be replaced. This gives me great pause. Brian Moore is why I am still here. He came up to me at one point during COVID and asked me a simple question: how are you doing? But the key part of that, he sat and listened to the whole thing. He sat and listened to my concerns with compassion, with kindness, and true interest. I've been supported as a leader by Brian and this whole executive team. Replacing an executive team member mid-crisis, as we are in, is a huge strategic risk. It delays decision-making, it derails operational plans, and it can send a message of instability to staff, partners, and community. Recruiting and onboarding a new CEO takes time and money. Estimated costs are close to 1.8 million. I don't think we have that. Another source states 1 to 4 times annual salary of team sets the tone for transparency, accountability, and engagement. In times of uncertainty, staff look to them for direction. Leadership changes now could erode trust, increase turnover, and worsen morale, making recovery efforts even harder. The election and the board turnover has already, in small attempts, started this process. Instead of replacing our executive team, I suggest that you work closely with them, partner with them, increase accountability, board engagement, find different tools to use besides replacing the leadership team that we already have in place. As a clinical manager, I see firsthand how decisions at the top roll down to the front lines. The executive team has been responsive, engaged. Morale in my specific unit has taken a little bit of a hit due to the election of the new board. I welcome you with open arms. It's just another uncertain component to the whole thing amid these financial recoveries. Brian and Jen asked the other day, actually it was Jen who asked me the other day, what can I do to support you? I said, nothing to support me, I've got it. I need you to go to my team. I need you to talk to them. They were up there on my unit talking with the team. They were talking with the nurses and they were answering their questions. They've been up there twice and this was just a week ago. I have nurses that have made it through COVID. I had the strongest culture in the hospital with the least turnover. And these nurses are now turning to me and asking, do I need to worry about my job? Do I have a job? Will I have a job? They came out of COVID with a stronger sense of culture and compassion and considered their team a family. I support our executive team in our hospital, and I want to see both of them thrive and us come through the other side of this crisis. I want to retire from this hospital. I want to see my employees retire from this hospital. They know this hospital, they care about this hospital, they have the intricate, detailed knowledge that as a new board, you need. There's no bit of cramming for this. This is the long haul. This is the long road. And you guys have stepped in some big shoes to fill. I truly believe replacing them now would set us back and not move us forward. It turns out leadership matters. Thank you, Brian.
Thank you, Sharon.
Tracy Sweeley, Coos Bay. First, I would like to thank the new board members for your courage and determination to take on the task of submersing yourselves in the details and considering new and different options for turning the hospital's financial situation around. I would also like to congratulate you on gaining the trust of the community. You conveyed your insight into the hospital's financial position and your vision for it to obtain a solid mandate from the community. In a much needed reconciliation between the hospital board and the wider community, you have revealed your desire for greater transparency. To that end, a first step would be for this board in its new configuration to release the entire upcoming July 22nd Finance Committee meeting agenda packet
and likewise all subsequent packets to the public. This should be done sufficiently in advance for the members of the community to familiarize themselves prior to the meeting. Thank you again, and please be assured that an informed community is a community that can support you in what is sure to be a monumental undertaking. Thank you.
Thank you, Tracy. Someone else?
Hi, my name.
I'm unable to turn off any person online who has their microphone on. So if you do not have your microphone off, please be respectful.
Please mute yourself if you're online. Thank you.
Hi, my name is Sandy and I'm a nurse in the Family Birth Center and I've been here for 20 years. My son is a CT tech upstairs and my daughter works in supply in the mail room. So we have some strong opinions about keeping this hospital open. I want to say congratulations to all of you new board members, and I expect that you will make lots of changes that will take us in new directions. Some of the changes you might make may not please the current administration. Some may not please us employees. Some may not even please.
My name is Arlene Roebling. I'm formally a candidate for this board. I'd like to congratulate the people who have won the election and wish them well in finding solution to the problem. I have been witness to the previous board and the leadership team and the executive team and their great commitment toward finding a solution to keeping this hospital open and as efficient and caregiving as it is. It's an amazing place. Please, new board members, as you move forward, recognize that this is not a personal pride issue. No good will come of holding on to previously held prejudice or agenda. The only way forward is to open your mind and your heart to solutions, however difficult, however it may go against what you've been saying and believing all the time. If you find a different solution, please look at it and keep open to it. Honor this community and all of the citizens in this community. Honor them with honesty, open minds, and doing the best will for all of us. I wish you the very best in that endeavor. Thank you.
Dr. Derek Orgowski.
Hello, for those who don't know, my name is Dr. Derek Orgowski. I think it's fair to say that I'm this hospital's busiest surgeon. I operate here 2 days a week, and it seems like sometimes it's 5 days a week. My practice is based at North Bend Medical Center. I will tell you that I've been here 5 years, and I love it here. And I think part of why I love it here is because I have a good working relationship with the leadership of this hospital. I can tell you in full honesty and transparency, I have disagreed with Brian Moore. I have disagreed with Jen Collins. I've disagreed just today with Devin Turney.
Yes.
But I have never doubted their commitment to this community. I have never doubted their motives. What Chandler said earlier about Brian putting this community first and asking those types of questions is absolutely true. He has always done that in his dealings with me and been fair and reasonable in those situations. Perception matters a lot. And so I'll put out, something. I run one of the busiest bariatric surgery programs in the whole state. We're also the top rated by patients in the entire state. Okay. And next year, we're on track to have more patients next year than we had this year. Okay. Bay Area Hospital has struggled with attracting commercial payers. We attract the patients who don't have a ride to Eugene. Now, there's many community reasons for that, okay? But one of those reasons is perception, okay? So as board members, I need to run my successful business as a surgeon, I need you guys to be cheerleaders of this hospital. So if you say this hospital has high infection rates, or you say this hospital has this, or this hospital has that, and you're saying that as criticism of our current leadership or criticism of where we stand now, and particularly if you say that without evidence, that's severely damaging to our ability to work as a team to do the kind of great care that we actually do. Because I can tell you that the data speaks for itself. All hospitals have areas where they struggle, but I can tell you after speaking with the infection preventionists within the past couple months, in general surgery, we have the lowest rate of post-op wound infections in colon surgery for any hospital our size in the whole state, okay? I have witnessed our hospital run mass transfusions for people who are hemorrhaging better than they do at OHSU where I train. Okay? I have seen patients with devastating traumas be resuscitated here in ways that no hospital our size should be able to do. We have a fabulous team here. And the thing we need most from a board right now is stable, thoughtful leadership and cheerleaders. We need this community to do what it's doing right now, which is showing up in this room and really caring about this community, really caring about this institution. Now, I'm not privy to the finances. I don't know whether partnership with an outside entity is the right move. I don't know whether some sort of local thing is the right move. I'm not the right person to have that opinion. But what I'll tell you is that I trust our leadership. They have always been fair in their dealings with me. I trust their motives. And what I need more than anything to be a successful surgeon in this community, and what I think our community needs more than anything, is a board that champions Bay Area Hospital and tells our community just how fabulous Bay Area Hospital is, because we punch way above our weight. This is a great hospital. And if the people who drive out of town to Eugene because they have a perception problem walk through our door for elective surgery, and we could have a rate of private paying insurance of 20%, we'd be in the black. But there's no doubt that with just fixing the perception problem, and it's not unattainable. North Bend Medical Center has that. Dr. Trissini probably knows the number better than I do, but has a higher rate of private paying insurance patients. So it's that leadership we need from the board to be out there cheering us on, instead of pulling us back or dividing us. We need to come together in this moment. Thanks for hearing me out.
All of you sharing your thoughts with us today. Now we're going to move into the next part of the agenda, which is swearing in and the oath of office for our four new board members. Have our notary up there. Come forward. Or you in all together. Yeah. Megan, you do the swearing in, or?
No.
Notary
does.
Notary does.
I haven't done this part before.
Okay.
Oh,
You want to
okay. I'm Jenny Cantrell. I'm your local mobile notary. Your hospital has my cards on file as well as all the care facilities, because I'm trying to serve this community by going to people who can't get out. It's my pleasure to swear in the new board members. Simon Alonzo, Kyle Stevens, Brandon Sada, and John Uno, MD. If you would please come up and raise your hand. Please raise your right hand. Do you solemnly swear that you will support the Constitution of the United States, the Constitution of the State of Oregon, and the laws thereof, and the policies of the Bay Area Hospital District? During my term, I will faithfully and impartially perform the duties of the Bay Area Hospital Board of Directors member to the best of my abilities. Yeah. Very good. Would you please find your paper and sign? Oh, here. Thank you.
And I need your signatures in my book. I brought. Oh, there you go, and you may keep the pens that have my number on.
You want my ID?
I'm gonna say that you're you, okay? I will say there are plenty of credible witnesses.
Yeah.
The date is July 8th, by the way. Oh, yeah, yeah. My memory bag is heavy enough. In fact, earlier this year in January, I shattered my left elbow and Dr. McCall spent 8 hours piecing it back together. And I have had nothing but great care here.
I just have one more to do. So the next item on the agenda is we talked about the fact that we have policies and procedures that were written for a more gradual transition forward. So an area of concern was policy and procedures for the prerequisites for the board chair, with the recommendation being that someone had served as a vice chair of the board or at least 1 year as a chair of the board of committee. And by definition, that means 4 out of the 6 are not eligible. So this is not a bylaws, this is a procedural issue. These are guidelines and guardrails given to us from our education with the Governance Institute. In fact, sitting in front of me is Lynn Menashin, who was responsible for getting these policies and procedures set up. I will entertain a motion that we at least do a waiver in this situation for those prerequisite requirements.
Motion. Second.
We have a move and a second. Any discussion? All in favor?
Aye.
So the next phase is election of board officers. I'd like to hear any potential nominations for the board chair position.
Nominate Simon Alonso for board chair.
Second that.
Andrew, the chair.
For the record, I'm sorry, I didn't catch the motion in second on the first for Simon.
Simon, it was Brandon and Kyle.
Thank you.
Patrice is doing another nomination.
Thank you.
I'm nominating Tom McAndrew for chair.
I'll second myself. So we have two, what I'd like to do is basically the two of us perhaps just say what our background, experience, and interest is before we go for a vote. Simon, you want to start or you want me to start?
You can start.
Okay, so I'm not one that normally gravitates toward wanting to be a board chair. It's a lot of work But in this particular situation, on the brink of a bank foreclosure, I believe that continuity serves the institution well. It's reassuring both our community and our staff and our bank. My experience, I was a doctoral student in public health before I went to medical school. I've been a physician for 40 years. I've been a family medicine doctor in this community 37 years. I've been on the hospital board 25 years. I stand on the shoulders of the individuals who have given service to this community in hospital leadership. I see Lynn in the audience, but there's many, many esteemed people that I've learned from. I can say that knowledge, experience, and judgment are part of any leadership position. We all can learn, we all can have different experiences and learn many things. Judgment comes from wisdom. Wisdom comes from being a failure, and that's life experience. So I can advocate that I have learned from my personal and professional failures. With that, I'm going to pass it off to Simon.
So I'm Simon. I'm a small business owner here in town. I have experience in operations and leadership in my companies. I have not been a physician for 40 years, but I have had experience leading teams and managing operations. In the end, the chair's role is to be that liaison between the board and the CEO. And the CEO's job is to run the hospital. And it's also the chair's job to portray what the board wants to the community and to the executive team. And really, that's the experience that I bring to this role. And so if the board decides to elect me, I'd be happy to do it.
So I think that let's go ahead with the first motion then. We have two different nominees. Why don't we vote on Simon? Or you help me, since I'm also one of the nominees. So,
Probably should do individual votes.
All those in favor of Simon?
yeah, let's do that. All those in favor of Simon, please say aye.
Aye.
And all those opposed? So that makes it irrelevant to have a second vote. So I will pass the mic on to the chair.
Get a book.
Yeah.
Yeah.
Thank you, Dr. McAndrews. So we'll move on to a nomination for vice chair, secretary, or treasurer. Do we have any nominations for vice chair?
Nominate Tom McAndrew for vice chair.
Do we have a second?
Second that.
Any discussion? All in favor?
Aye.
Dr. McAndrews, you're the vice chair. And Patrice, I understand you're currently the secretary. It's your term.
Yes, it'll be up on 2 years.
Okay, perfect. So we do have a nomination for secretary. Yeah. I'll nominate Patrice to maintain as secretary.
One second.
Any discussion? All in favor?
Aye.
Patrice?
For clarity's sake, the motion and second, please.
Simon.
The motion was from me and the second was from Brandon.
Thank you.
Last, we have treasurer. Do we have a nomination for treasurer?
Nominate Stevens.
I'll second that.
Any other motions? Any discussion?
I just wanted to point out that normally whoever is the treasurer is also the chair of the finance committee from the board. And is how it's written in.
No, I don't want to take the straight audit.
You don't have to accept the nomination.
You got it.
Okay, no discussion other than that. All in favor? Aye.
Is that 3 votes? 3 aye votes. Can I pull the board, please?
Aye.
Right now we have committee appointments, the Quality and Patient Safety Committee. Currently, we have Treese, you lead that committee, correct? Are you on there, Dr. Sanders?
No, but I'd like to see Arlene Rowland in that position. She's done well in the last few months with that.
She would be a community member.
Yes. Okay.
I'll be on that committee.
That's good.
Give me that second, Kyle. Can you speak up? We can't hear you.
There was no, it was Dr. Uno volunteering. So Dr. Uno, if you'd like to volunteer, I'll appoint you to that committee.
Yes.
Any opposition or questions?
But do we also appoint Arlene to that position?
Yeah.
We need more than one community member. We have a board member, but we need community members.
And who is our current?
We have one that is,
Arlene was there as a board member, I believe.
hang on.
Looks like we have two board members. I'm getting here, but we do have two. We have Dr. Uno and we have Patrice. Yeah. So,
Is Doug.
Yeah.
Charter says two PPSC from the board. We have you, Dr. Uno, is number 2.
Yes, and the community member
Community, Arlene,
is Doug.
Doug Jones, Arlene, and Lisa Castle from Advanced Health.
He's from Advanced Health.
The chair.
Patrice is.
Okay, thank you.
So Arlene, it sounds like you're being nominated and I would love to have you there if you'd like. Thank you so much. We're on to the Finance Committee. Is there any, we'll start with the community because it sounds like I need to appoint some community members. Is there any community members that'd like to volunteer? Got one?
Judy Booty.
Okay, Judy, is there anybody else that'd like to volunteer? All right, Judy, I'll appoint you to that committee. Thank you. All right, for
Can I make some recommendations for finance? We have Renee Nelson has been integrally involved. I think Barb Taylor is staying on the committee and she is our resource, but I'd like to see Renee Nelson be appointed. Thank you. Oh, Troy Cribbins was interested in being on finance as well.
okay, I know Renee and I think Renee would be a great addition to the Finance Committee. And if Renee would like to, I'll speak with her and then we can appoint her.
I think she was interested.
Does Renee happen to be online? Okay. I think I'll turn to Megan for that. Can I appoint her without her being here?
And then you can also just call her and appoint her later.
Okay.
It actually does not need to be done in the meetings. You're just
Perfect.
appointing and stuff.
Great, thank you. All right, for the board members on the Finance Committee, I would like to be there. Is there any other board members that would like to be on that committee?
I usually just attend. I don't.
And I think I'm still a member of the committees.
It would be maxed out then. Yeah.
Oh, if someone else wants to do it, that's
I would go in the finance.
okay.
Megan, how does it work with appointing myself for the Finance Committee?
That's fine. And for the finance, there just has to be at least 2 board members. There can be more. So, yeah.
And traditionally, most of us have attended the finance committee, whether we're voting members or not. It's very helpful education to know what you're going to get at the packet.
Well, I think if there's no opposition from it, I'll appoint Dr. McAndrews, myself, and Brandon Zana.
And just to clarify, then is Kyle chair though as treasurer, or did we?
I will be the chair of that one, yes. And it sounds like we're just gonna have to have a public meeting for that one.
Not, and that's fine. And I just want to make sure too, though, yes, because then we'll need a form out all the finance. Okay.
Great, you'll all get notified. We have a finance meeting, so we'll expect all of you there.
Yes, that would be
I've
nice.
attended several meetings and I haven't seen this many people, so. All right, the committee appointments are completed there. We're on to the consent agenda. I'll need a motion to approve it, but Megan, I'm going to defer to you again because we weren't here as board members. So is it okay to motion and second, or do we need to leave that to Dr. McAndrews? Please.
Yeah, motion in second, so.
Can I get a motion to approve the consent agenda? Get a first and
I'll second.
get a second. Any discussion? All in favor? Consent agenda is approved. All right, we are moving on to the medical staff report. Excuse me.
Yeah. Hi.
We need to
Yes.
give you a mic.
You need a microphone down here.
Yeah, one of those.
Dr. Alturi, I'll pass over to you. Did I say that correctly? Atlery, okay, perfect. I've got to get it right sometime.
Sure, you'll get it. Hi, good evening, everyone. Thank you all for being here. On behalf of medical staff, I want to extend a warm welcome to all the new board members. As somebody has already pointed, it's going to be pretty challenging, and we're going to rely on your collective brain power to make the right decision in the next few weeks. Bay Area serves not only the Coos County residents, but also patients from Curry, Lincoln, and also Douglas counties. We take a lot of critical access patients from critical access hospitals spread across all these counties. And pretty much any ICU patient, any patient that needs higher level of care usually ends up at Bay Area Hospital. So as such, our commitment to providing quality care extends to a broader geographic area, just not to the Coos County alone. I want to say that I'm very proud to work with all the medical staff members. That includes all the physicians, the providers, the nursing team, and the leadership team. And they're very passionate about everything we do. So, and our only goal is caring for our patients and the best provider. So I respectfully ask that all decisions that are going to be made in the next few days, next few weeks, are carefully considered, ensuring that they do not adversely impact our ability to serve for our patients and our community. We are currently facing significant challenges in securing beds for patients transfers to higher level of care. And any action that further strains our capacity could push us towards a statewide health crisis. I have requested our MEC members and representatives from Bay Clinic and also NBMC to be here. And I yield my time to our medical staff here to share their concerns in person. First. Thank you.
My name is Derek Waka, I'm a nurse physician and director of the emergency department. Thanks for this opportunity to speak. As some may see, if our patient population cannot get in to see their primary care provider, or if some unexpected illness or injury happens, the emergency department serves as a safety net for all counties that Dr. Atlery mentioned. We all know that the specialty presence here is pretty scarce, and the physicians that are here that are working are being pushed to their limits. The biggest concern that I have for my team is just how are we going to continue with this? The population, as we know, is getting older. The last of the baby boomers are going to be in that age group where they're going to be utilizing our healthcare system to levels never seen before. How is Coos Bay going to deal with this influx of patients and maintain the status quo, if not modernize for healthcare delivery? Again, my hat's off to you for volunteering for this role and campaigning to get elected. And I'm hoping that we are able to work together and develop strategies forward. Just because when you look into the volume of patients that we're going to be receiving to the medical professional presence that we have here in Coos Bay, there's a significant mismatch. So it's a round peg in a square hole. I think that's how I said, a square peg and a round hole problem that we have to solve. And we can only solve this, as mentioned, by working together.
planning on talking, but okay. I'm Dr. Wendy Cox. I'm the medical director of the critical care unit. And the one thing that I would ask the board is to please help support the unit. We currently give care to from Gold Beach and Brookings to Crescent City. We're getting patients from Florence. We're getting patients from Newport. We're getting patients from Astoria. We are basically a critical care unit that's serving up and down the coast. We have excellent backup from Oregon Health Sciences University. We have a contract for a virtual ICU, and I would ask that you please keep that in place. They help us to provide excellent care to our patients and keep our patients here in the community, which are just vital. And they help us become better physicians because they teach us while we're utilizing their skills. So we ask that you really consult two physicians as you make decisions. Ask our opinions. Yeah, we're opinionated, but you know, some of them are good opinions. So please just involve us as appropriate in decision making so that we can give the kind of care we do give and keep our patients here in the community healthy and well. Thank you.
Need to go to Dr. James or Dr. Tersini. Dr. Tersini, I see you smiling, but I see your head is also down. Right here. James? Yeah. Okay. I'm Dr. Kim James. I am the department chair for OBGYN here. I just would like to welcome you. This community hospital is near and dear to my heart because I grew up here. I went to Marshall. I then went along to medical school and served in the United States Navy and have practiced all over and came back to my community. Mostly to serve my parents who are aging in this community and the hospital and the community itself. I always say that the hospital for delivering babies is one way that our hospital is a very positive note. Sometimes it's the first time that anybody's been in the hospital. Our labor and delivery nurses are amazing. And it is the big concerns are retaining physicians. We are in a primary care crisis. We don't have many primary cares. We are also have to work on retainment of those physicians once we get them. And we need to protect our services that we have currently. And because if our hospital goes down, there's nobody around locally that can serve obstetric patients. We already live in a bubble here in this community, and it's very important to know that we don't want to shut down our hospital because we don't have anything close that can compare to the passionate care, the quality of care that we deliver here with the current staff. Our culture is one that I would like to see expand and become one of those community centers, community hospitals that we're all very proud of serving, and bring in more staff to support us because we are very short-handed as far as for obstetricians, and not have to rely so much on outside docs coming in to fill in the gaps, because it is a difficult thing to do call
all and specifically care for our patients and keep that quality up. So I just would like to welcome you and just keep that open as far as thinking about future recruitment for us and for all primary care, because that's where our basis is, and we are in crisis in our community for that. Patients do not. The OBGYN is not the primary care. I just want to say that. So I'd like to thank you for that and just thinking that we value your support and your dedication to thinking about retaining what we have. That's very important. And then also thinking about recruitment, and that goes to that cheerleading that Dr. Rogowski is talking about, because this is a very special place. Yeah, I think that's about it. Thank you.
I'm Jenny DeLeon. I'm the Chief of Pediatrics. I'm the Medical Director of the Kids Hope Center. I will let you guys know that in the country, pediatrics is being closed down at many hospitals. And I understand why. We are always at risk being closed down because, I hate to say this, but vaccines make it so that kids don't get admitted to the hospital. And so we don't see as many children as other hospitals do, but we are in a rural area, and we have to be ready to be able to take care of anybody that comes in. When it comes to labor and delivery, I would argue respectfully with Shelley that the labor and delivery nurses, which include the nurses that take care of newborns, are the strongest nurses that I notice in the hospital. That's probably not incredibly objective. There might be a little bias there because I hang out with them all day, but they are very strong advocates for each other. They're very strong advocates for the children. They are very strong advocates for mothers. And I have seen the department, I've seen the concern that they have demonstrated about the department being cut. They are afraid, even though this is, this is the only place in the region where children or where any kind of high risk deliveries occur. And I just want to make sure that you guys understand that when you are making your financial decisions. As for the Kids Hope Center, I really, really recommend that you continue that. It is financially, generally through grants and fundraising, that hasn't been a financial issue, but I really would, if there is any concerns that you have, please feel free to speak to us. I would love it if any decisions that were made were discussed with the people that they affect, rather than a unilateral decision that we have to figure out later. Thank you.
My name is Steve Tersini. I'm a general surgeon. I've been in the community for about 30 years. I'm mostly retired from general surgery now, but I help the general surgeons occasionally when they need help on weekends during the week. I've been here a long time, and I've seen a lot of changes that have happened during the last 30 years. I remember when I first came here, we used to do pediatric cases. We used to do vascular. We had a wide range of operations that we did. And like Dr. Rogalski said, we punched well above our weight class. You would not believe the types of procedures we can do at this hospital and the ability we have. But the reason we were able to do that is because there was collaboration between the physicians and the hospital. Collaboration is the key. Now that I'm not doing surgery so much anymore, I'm now the acting CEO of North Bend Medical Center. So I get to see things from the other side now. And I realize that in order to run a hospital, you have to have physicians. Because really, when you think about it, although the patients come here, it's the physicians that are they're the ones who consume the product. They bring the patients here to the hospital. So without physicians, you're not going to have a hospital. And North Bend Medical Center being the largest physician provider on the South Coast, the key to this whole process is collaboration. That's what makes Bay Area Hospital and this community good, is a collaboration between the hospital and the physicians. So what I would encourage you is to collaborate with the physicians. We can do a lot together. We can work together. We can make this place great again. I shouldn't have said that, right? Sorry about that. I'm too politically charged. Anyway, we need to collaborate. So when you make the decisions, talk with us, just like Jenny said. And I think that we can actually do great things here. Thank you.
I'll keep it brief. I already spoke, but one of my other roles is actually I'm also the trauma medical director. So that's probably the role where I am most part of the hospital apparatus. I'm an independent physician from the medical center, but I am the trauma medical director here. And what I think I would sum up from hearing from multiple departments is there's no fat to cut here. Okay, this is a problem where we need to grow out of it. We need to increase service and increase business and find a way to continue to provide the essential services we're currently providing, and maybe add some new and profitable service lines or get investment to allow us to do things better. You know, I tell my patients all the time, they come into my office and they complain, they say, it took me a month to see you and now you're late to my visit. I say, well, we're supposed to have 5 general surgeons in town. We have 3 and I'm doing my best. That's the reality of general surgery. I'm sure the reality in emergency department staffing is the same. I'm sure Josh and Devin struggle to staff to do what we're doing, because we're doing what we're doing all out. All of the general surgeons in this community are performing above average amounts of general surgery to try to meet the community need. I'm sure the same is true of the OBGYNs. I'm sure the same is true of orthopedists. There's not going to be a lot of fat to cut. What we need is more hands pulling in the same direction. So I completely echo everything that's been said by the other physicians here.
Thank you all, and thank you so much for taking the time to hear us out, and look forward to working with you. Thank you.
Thank you. Thank you, Dr. Valerie. I got that right this time. Thank you to the rest of the physicians that spoke tonight. Thank you. With that, we will move to the report from the Chief Executive Officer, Brian Moore.
Thanks, Will. Good evening. I knew that this evening's agenda would be heavy on the the entree and welcome activities. The night's already getting late, and yet I know we have very, very important work to do. In the aftermath of the campaign season is a lack of trust, understanding, and communication between the board and administration. And for a lot of the reasons that we heard this evening, we need to fix that. We need to move forward and resolve it. And I'm ready to start listening right now in terms of where do we go from here. I think one of the things that I want to convey in our first public meeting is a sense of urgency to determine the strategic direction of the hospital. I can think of Bay Area Hospital as a ship, 1,100 people big, 50 years in the community. It is not something that moves or turns quickly. Our ship right now isn't sitting safely in the Mediterranean, sheltered from big storms. I think of us more sitting on the Niagara River. And as we have seen a pause in the direction of moving the hospital towards safety and a plan forward, we find the environment dragging us closer towards that waterfall. And so how can we help? I don't think it's probably going to fit neatly in our monthly board meeting time frame. It's probably going to require some extra time. You may have ideas that need additional vetting. We may need to think about, a series of meetings, some strategic retreat time to dive in, for us to listen, for us to understand questions that we need to follow up as administration, dive in and answer. But hopefully that's a shared goal to understand what is that strategic direction? How do we get clarity? And how do we quickly regain the organization's momentum towards moving to that safer place? We really do have 100,000 people and 1,100 employees depending on us to get this right and get it figured out. The truth is you don't need a CEO for the hospital to be okay tomorrow. It's got enough inertia that's going to be there tomorrow. You need a CEO partnering with the board to figure out where's the hospital going to be in 5 and 10 years from now. And, with the current pause, frankly, it's been very difficult for me to do my job as we've gone through this period of transition, because the biggest piece of my job is to point the organization, forward into that future reality. And so we need to determine what that direction is. And as I said, if there is a sense of what that direction is, like let's start that dialogue tonight. If there's a sense of what those questions are, let's start that exploration so we can get there. So Simon, with your chair role, I'm sure we'll be spending some time to talk about how we orchestrate this and make it fit the goals of the board and the time constraints and availability. And look forward to engaging with you on that.
Thank you. And I'll just add real quick that it's clear there's difference of opinions in this room, but nothing's happening today. There's no decisions. We as the new board members have gotten 7 days to look at some of the information that this board has had for months. So we're going to continue to review that, and we're going to continue to go through it. And I look forward to the conversations with you, Brian, about that direction. That being said, Brian, on your agenda, you did have a couple of things. Did you want to do any more, or are you?
I'm happy to jump into some dialogue. There's obviously been a lot going on that's going to impact our strategy from the legislative perspective. I've included an update there. I think for me, the big focus with the short time on the agenda tonight is really just to talk about, what are those steps and how do we come together to start determining that strategic direction?
Sure. Brandon has said he wants to make a motion with that, so I'll entertain a motion right now.
I move that the board establish a standing transparency and outreach committee tasked with strengthening communication between the hospital and the public and improving community engagement and feedback mechanisms. I further move to appoint Dr. John Uno as the initial board member representative on this committee. The committee will return to the board with a proposed charter outlining its specific responsibilities and composition. Do I have a second?
Yep, for that, Dr.
Yeah. So we have a motion and a second for Brandon's committee. Do we have any discussion on that?
Can you flesh out what the goal of the new committee might be?
Yeah, well, I mean, it's been said here multiple times by multiple members of the community that there seems to be a transparency issue. There seems to be a communication issue. There's a mistrust issue. So really what I wanted is a committee that is dedicated to figuring out why there is this mistrust between public and staff, and even between staff. I have different stories of the same situation. So I would like light shed on all of this. And I think it would help to have some sort of mechanism in place that constantly can keep everybody up to date without people having to seek that information themselves.
Might it be a subcommittee to create a permanent committee? Creates a lot of bureaucracy. I think that the intent is a good one. A standing committee, I never have seen. I agree we have difficulties with our communication with our public.
That's one of the biggest problems we have with the public is that there's no transparency. I think that one of the biggest problems we have is where there's no transparency. And we better have a permanent committee.
I'd entertain to say temporary, or we could change it to a task force.
I think that the concept of a task force makes better sense to me.
We'd have to amend that part.
Big truths. Do we have another mic we can borrow down here to make it a little easier?
If we're going to have a task force or do something like this, we also need to include our legal to make sure that what we are proposing to share with this transparency is legal within the confines of this being a district hospital.
I agree. We would need to have legal insight there. Of course, I'm understanding that the information you're looking for is the things that are provided at the board meeting just ahead of time. And you want to have a little more open dialogue for the things that are already public. Is that what you're?
That'd be part of it, yeah.
It's discussed in the board meeting, should be public.
Megan, is there any issues here with us forming a new committee?
You can form a new committee. We probably need to admit.
Give her a microphone.
I can be loud. You can form a new committee, but then we'd also need to amend the bylaws and kind of put out, workshop what it's going to be, what it's going to accomplish. Do you have board members? Are we going to have meetings? Does it report to the board? Because if it does, then we're going to need to do notices just like we do on these other ones. So there is some stuff to kind of figure out how you want it to look and how we're going to integrate it. But you're definitely able to form a new committee. So a suggestion, you can form one now, but it might make sense to work out kind of the contours of what you want and come up with a plan, and we could do it by a resolution and also amend the bylaws at the same time. So you could decide if you want to go forward in shaping or discussing one. I mean, we could just add one at this time, but I think it might make sense to get input and decide how you want it to look and what you want it to do and that sort of function. If that makes sense. So but it is up to you. I mean, yes, we definitely would need to update the bylaws, or we can kind of.
Yeah, you can behave yourself. We're trying to. Yeah.
If you're online, please mute yourself. I got it. Just let me go.
Sorry. So it's at your discretion how you want to move forward with that.
So the last part was that those specifics would be determined later. Yeah. This was just starting it, and then all the specifics will be determined later, is what my motion says.
So my recommendation might be then to get something written up that maybe continue this discussion and maybe put it on an agenda for a meeting. So I mean, I guess you could vote if you want to go forward with this idea, and then if everyone has buy-in, then that could be something you guys could shape.
Tomorrow. Yes. So I was just going to say that if we amend this to put this on a future agenda, I think that's fine. I am in favor of a transparency committee. I think that the community has asked for that. It's clear that there's things that we won't be able to share, but we should do our part in being transparent. So I would agree with that. So let's amend your motion.
Table it tomorrow.
Table it until our
Make a
next
motion.
board meeting. Yeah.
I'll make a motion for the board. I'll make a motion for the board to look into the development of a committee for improved transparency and details to be listed and then voted on in the next board meeting.
Second the motion. Any other discussion? All in favor? We got through the painful process. First of many. All right, I think we should turn it back over to Brian to see if you have anything else to add there, Brian. Need to jump a mic back over. We will do better and get more mics, I promise.
Don't even turn it on. It's dying.
Yeah.
Use that microphone.
Yes, okay. Well, let's just touch briefly on the legislative update. The state legislative season ended before the big beautiful bill passed, we're going to start seeing some changes as early in 26 in terms of the way that folks are qualified and requalified for continued coverage under Medicaid. But some of the biggest funding impacts really won't take place for another couple of years in 2028 when they start reducing the provider tax maximum, which currently sits at 6% and will start ticking down in 0.5% increments. What happens is hospitals pay a tax on a quarterly basis that funds Medicaid here. Medicaid and the state of Oregon reports that budgeted expenditure to the federal government. The federal government says, well, we're going to match your dollars and multiply your dollars and then send it back. And this is a common way that states across the country fund Medicaid. And so what this is going to do is essentially have a significant impact and reduce the overall funding that the state plan has. Bay Area Hospital, we're not the largest Medicaid provider by any stretch in the state, but we're a significant Medicaid provider. And so that's definitely going to create some financial challenges for us. As we think about the legislative session, just today I was hearing a growing expectation that the state will be, the governor will be convening a special session to focus really on transportation. I do wonder if there's an opportunity for us to continue the work of looking at a permanent enhanced Medicaid funding that started late in the session. And I guess I would just put that on our radar screen as we think about our lobbying efforts here through the summer to really be positioned. The big beautiful bill also includes a carve out to kind of offset the negative impact on rural hospitals. And I think we'd be wise to try to map out who in Oregon is going to be mapping out the state plan for Oregon's piece of that rural offset funding and figure out if there's a way that Bay Area Hospital could be a specific beneficiary in there. So I think we need to continue our involvement, even though the state legislative season is concluded. They're likely to be back in session. And I think we're all still trying to wrap our head around really what are the impacts of the federal changes around the Medicaid program. You guys have probably been reading some of the headlines. I'm happy to take any questions or thoughts that you have as we think about trying to, take advantage of this change and make sure the messages of our community are heard by those who could make a difference.
What's the current percentage Medicaid of our patient mix?
I think we currently sit, Karen, do you have that latest number? No. Yeah, but that's the whole mix.
I'm guessing 2025, but I don't know.
I want to say we're close to 20%. I can follow up with the more specific number.
60% of pediatrics.
$1 trillion out of the Medicaid budget is a lot more than waste and fraud. It's a big hit for our community.
Yeah.
Any other questions?
Thank you.
Yeah. Thank you. Brian, you had a question here for discussion about advocate for that bill. And I think that you're correct. We should continue to advocate, but until the session opens, I think we should just continue to work on it behind the scenes. I don't think there's anything for the board to act on for that. And I don't see any other questions. Is that correct? Do you have anything else, Brian?
No, I will yield my time. Thank you.
Thank you. Well, I did want to add, you had a question in here for discussion in the agenda to strengthen our partnership with the community and other healthcare stakeholders and support advocacy goals. I would like to see the executive team continue that partnership, like Dr. Tersini said, with the physicians and the other local healthcare groups, because it seems like there's a lack of trust somewhere in the system, and I'd love for executive team to continue working on that. Well, perfect. Brian, did you want to continue to the next part on your section of the agenda, the strategic direction?
I don't think I have anything additional tonight in that regard.
Okay, thank you. All right. With that, we will remove to the Quality and Patient Safety Committee report from Patrice. I'm going to pass this over to you.
Quality met this last month of June. And we had several presentations, one from our laboratory manager, Eamon Morgan Brown, director, one from Ms. Nelson from the Family Birth Center, and one from Kaylee Scheffelmeyer. And she gave us a presentation on our level 3 trauma program. All those programs are doing excellent work. We were very impressed with their presentations. We also had presentations from Kelly Bion on the latest CQC meeting, which is the Comprehensive Quality Committee, and she reviewed some of the leapfrog scores and quality safety oversight. Also our quarterly board report card. All of our main reporting guidelines, catheter-acquired urinary tract infection, etc., central line, sepsis, PSI 90, and heart failure readmissions and regular readmissions met at least the minimum benchmark. The only thing that did not meet the minimum benchmark is mortality, and that seems to be chronic because that's not just an actual number. It's somehow calculated. I also have some information that is very positive for quality. The American College of Cardiology Chest Pain and MI Registry moved our Silver Performance Achievement Award in 2024 to the Platinum Award in 2025. The American Heart Association Achievement Award for Resuscitation Care is a 2025 Silver Achievement Award for rural heart failure as well. Yeah, several awards, silver, gold, and platinum. Michelle Merrick also, she's a nurse that works very closely with the CQC, and she obtained her certification as a CPHQ, making her an expert in healthcare quality. Oh my God. In healthcare quality. So we're doing a lot of really good work. We have a lot of really good people working with quality and always trying to move that mark to a better spot. Thank you.
Thank you, Patrice.
Thank you. Thank you. Thank you, Patrice. All right, we're going to move on to the finance report from Karen Miller, the interim CFO.
Thank you. Can you hear me? Thank you so much. I was actually not expecting to speak tonight, but I'm excited to be here. Thank you. I'll keep it short. I do want to take a moment and welcome the new board members. This is your first meeting here. Being new, it's my first being here as interim CFO. I wish I could present better news for the hospital this month again, but unfortunately, I have to mention that we did have a $4 million loss for the month of May. Overall, a $21 million loss for the year to date through May. We don't have June's numbers quite ready to give yet, so I don't want to provide any of that information yet, but I do want to just take a minute to mention the urgency, like Brian had mentioned. I've only been here since March, came in as controller, and I did want to just, emphasize urgency in decision making. And, we are going to be having a call with the bank soon, and we do need to get some direction going from the board. So we appreciate any, guidance as soon as possible. Would be, we can't make any decisions to move forward until we know what direction we're going. So definitely would appreciate that guidance.
All right, thank you. We will move on to the section of the board where the board members give comments. And the first one on there is a report from me. Well, I'm brand new. So I have prepared a little bit of a statement just to introduce myself as the rest of the board members will. So I haven't met a lot of you, but my name is Simon, as you've learned. I've lived in this community pretty much my entire life. In my day job, I own a small business investment and management company. And my work keeps me involved in a bit of everything from operations and planning to leadership, but it all really comes down to serving the community. Serving the community is truly why I ran for the board. Area Hospital is a cornerstone of not only Coos Bay, but this entire region. Not just because of the healthcare it provides, but because of the jobs, the stability, and the peace of mind that it brings to the people who live here. When something is this important and it's struggling, I believe that you need to step up, and that's what I did. And that's why I'm here today. I know there's been a lot of talk and speculation about what the new board, quote, new board might do, or what direction we're headed, or what decisions are already made. And I get it. The uncertainty is hard, especially when people feel like they're in the dark. But rest assured, every one of us, new board, old board, all of us are being careful on how we handle this. We're being thoughtful. We're working as a team. We will work as a team to make the
So I'm Brandon, and I didn't know what Simon was going to say before he said it. I pretty much have to agree with everything he said. I think the hardest part of our job is that each person in this room has an individual viewpoint on this situation. That you have your data, but we as a collective up here have to sift through everyone's data, everyone's point of view, and listen to everyone's opinion and try to formulate our own opinion on this. Because as you all sit there, you all have your own knowledge of this situation. You have your own perspectives. You have your own experiences. And how do we as a board take in all of your information and come to what would be called the true story? I want you to think about that for a moment. How do we as a board listen to every single person here and figure out what is true and what's not true per se? Besides looking at actual numbers on a piece of paper, most of our brain has to think about the emotions behind everyone's words as well as the facts that are sitting in front of us. And the hardest part is going to be what knowledge that we have and how do we give you our knowledge of what everyone else is thinking and what everyone else knows. It's going to be very difficult, and that's one of the reasons I wanted to try to start a transparency committee, because that's the problem I keep running into is I'll talk to one person, I'll talk to another person, and it's the same situation, but two stories. And so how do I decide who's telling the true story? Because the truth of the matter is that neither one of those are true. There's an option C, correct? It's not always black and white. It's a lot of gray. And I think having started sifting through all this information and having spent the last 2 or 3 months actively engaging with my community and hearing story after story after story from past employees, from current employees, it's not very easy for us to figure out exactly what the real story is. And I just want everyone's patience and understanding that just because we don't come to the same conclusion as you, doesn't mean we're not listening.
Thank you.
I'm John Uno. I was a urologist for 30 years, and this hospital is part of me. And if I could do something to save it, I will.
Yeah, I'm gonna just pass it down. I think been plenty of talking tonight. I'll say mine for maybe night we're running late.
And I haven't talked too much today, but I did want to welcome this crew. We do have a collective responsibility to keep this place running. Let's get to work.
Thanks, Tom. I agree with that, ditto. And welcome, everybody. I hope we have time to get to know each other as we work together so that we can figure out the best move for Bay Area Hospital, because that has to be our focus.
That brings the board member comments to close and it moves us into executive session. I believe I have to read this statement, so bear with me. Executive session, we're going into executive session for ORS 192.6602. And Megan, do I need to read both bullets?
Yeah, if you want, I can read.
Yes, I defer to Megan to read this.
So the board of directors for the Bay Area Hospital District will now meet in executive session pursuant to ORS 192.6682C and F for the purpose of considering matters.
Turn to regular session. 7:48 p.m.
This might be extreme. This one was extremely, the other one I had.
Sounds like the wireless.
Yeah, I think right on the computer, yeah.
Okay. You're going back to the chair. I am, because I like.
Any other way?
Yeah. Well, and maybe one for at the very least.
You guys missed the bus.
All right. There we go. All right, now that we're done with the executive session and Megan has read that nice report for us that opens back up, we will entertain a motion to approve the credentialing report.
I'll move that we approve the credentialing report as presented.
We have a motion. Do we have a second?
I second.
We have a motion and a second. Any discussion? All right, all in favor? Aye. Credentialing report is passed. And that is the end of our meeting. Our next meeting will be August 12th. Our next regular scheduled meeting will be August 12th, unless we have anything else that anyone would like to add.
Dr. Michael's one of our physicians, and he didn't get a chance to talk in the middle of that. Is something that the board.
We would love to hear from you.
Oh, sure. Thank you. Yeah, I just wanted to, I'm sorry, I didn't realize this was going to be open for comments. And I know some of the other perhaps medical directors said something and I don't want to take much time, but introduce myself. I'm Dr. Philip Michael. I've been working part-time here for a couple of years and have been full-time medical director of the APU, the psychiatric unit here since January. And it's my privilege and honor to do so. And I just wanted to put in my word to advocate for preserving the psychiatric services, well, Bay Area Hospital in general, which is clearly an incredibly, as you've all, this is the reason why you're on the board, is incredibly important for the community and for the whole coast. But in specific, from my point of view, the psychiatric services, which are also incredibly important for the whole coast. I believe it's the only psychiatric unit on the coast. And it's a really, I've worked in several other psychiatric units. It's a wonderful, not large, but wonderful psychiatric unit with a great core of staff. And I know that it has had financial problems in the past. And we were working very hard also with the consultant Signet to address that. and to make it as efficient as we can, make it as financially viable as we can, keep it as full of patients as we can. We have a great core of providers in the unit, and we're only adding to that. So I just wanted to, and I also would say that I know that it was before my time, but that the community has stepped up a few years ago to very tangibly, with a large amount of money, help support the unit. So I know that the unit is very important to community members, to the private practitioners, to Coos Health and Wellness, to Waterfall, and we work very closely with all of them. And hopefully we can work with you all and with administration to continue to make the psychiatric unit the best place that it can be and preserve it for the community and really for the whole coast. So if any of you want to, if you want to come and get my point of view or our point of view, I'd be happy to give you any, not just opinion, but the best honest information that I can give you at any time. And I'm likewise open to hear from any one of you.
Thank you.
Thank you.
All right, well, if there's nothing else, then I will call the meeting adjourned at 7:52 p.m. Thank you.
Good job.
Well, are we gonna have another meeting in?
I'm not going to be here.
So I too?
And there in meeting, and you have to sign. There's 3 of them.
That's right. Thanks for speaking. Yeah. You're here.
So,